Hello, my wellbeing buddies. It's me, Steve, the mental health nurse, and we are looking at bipolar disorders. Now, there are many different languages around this, so I'm calling it bipolar. I am aware that this links into mania and hypomania. There is a term called unipolar bipolar. So we're just looking at bipolar disorders, and then we'll try and break some of this down. So what is bipolar? We'll have a look at that. We'll look at some of the risks. We'll discuss, as always, how it's assessed, some of those treatments, and we will look at the medication options. So bipolar is also known as a manic-depressive illness. So it's part of that mood disorder family, and it comes off the back of a manic depressive illness. So mental health conditions characterized by extreme shifts in mood, energy, and activity levels. So we can see energy levels going up, becoming very much manic, and then we've got those extreme lows where we feel really clinically depressed. So looking at mania, hypomania, or depression, which can significantly impact the daily function. So depending on which version you've got will depend on where you're at. And most people that I've assessed and spoken to with bipolar know the phases they're in, or at least they can predict them coming. And just having that insight is really useful because people are able to put in their safety plans and management plans and know what to do. So we'll just run through what those manic episodes might look like. So a manic episode is characterized by periods of high energy, euphoria, being impulsive, being quite flighty, having lots of thoughts, and again, can cause a lot of problems because really creative, generally poor decision making around money and finance. So lots of things that we need to be mindful of around that manic part. Equally, if we look at then at some of the things around the mania, then how they might feel. So they might feel happy, euphoric, sense of well-being. They get an uncontrolled sense of excitement. Things are quite fast. They may become slightly irritable and agitated, increase sexual energy, increase distractions, racing thoughts. They can come across very confident and incredibly adventurous. They feel like they're a bit untouchable, can't be harmed, feel like they can perform any physical or mental health task. So it's all of this really quick stuff. How they might behave. So this is what you're going to see. There might be a being more active than usual. So something that was quite calm is now being quite a lot. You might see the talk go quickly, or that they're making no sense. They could be over friendly, so that boundary piece. They may be saying do things that's inappropriate or out of character, little sleep or none at all. They come across being rude or aggressive. They may be self-medicating, so there's that drugs and alcohol side there. They could be spending money excessively. Again, there are some great techniques around that, such as freezing your bank cards, and losing social inhibitions or taking serious risks with regarding their safety. So that's the mania. The hypomania typically lasts then a few days. It can feel more manageable than mania. It will usually be around concentration and their daily activities. So they're not too badly affected by that. But other people will notice that shift and that change. Again, symptoms of a hypomania can include happiness, euphoric sense of well-being, being very excited, slightly irritable, and increased sexual energy, easily distracted, so racing thoughts, and increased self-esteem, self-confidence. The way that you might see hypomania then in somebody is being more active than usual, talking speeds increasing, being friendly, little sleep, spending money, and loss of social inhibition. So what causes that to happen then? How does that all come about? Well, basically, hypomania or mania could be caused through high levels of stress, changes sleep patterns, use of recreational drugs or alcohol. It could be a significant life change, so a trigger event. It could be problems around childbirth, bereavement, trauma, difficulty in life. So that could be social problems such as money, housing, loneliness. It could be side effects of medication and or other neurological conditions. So if we understand the cause, well, we get a much better idea about how we can treat this. Because if it is about change, then we can do that session on change with them. If it's about money, we can look at debt management, or we can look at finance, or we can look at benefit reviews or something like that. If it's housing, again, same thing. So let's not overprescribe a social related issue here, people. Let's just think about what it is we're going to do. So looking then at the risks, there are obviously plenty of risks here to then be thinking of around bipolar. So the risks around bipolar is the risk to physical health, because ultimately, if you're not sleeping, you're probably not eating and drinking well, there could be a chance of substance misuse, and all of that's going to impact on physical health. So just be mindful of that drop, the weight loss decline, etc. There's a risk to mental health here because, again, it leads to anxiety, it can lead to self-harm, and it can lead to suicidal thoughts because that behavior becomes risk-taking. It becomes quite short, it becomes quite impulsive, and that becomes a problem. Clearly, there is a risk to relationships when people inflate up and they become manic or hypomanic. It is exhausting for people around them. It can put a strain on family. It can put a strain on romance. It can put a strain on everybody because people around you are managing this, and that can become quite difficult. It can be a problem at work or at school. So again, the risk around what does that look like? Those mood swings, maybe having to spend time in hospital, and then finally risk around your finances. So lots of risks there to be thinking about and lots of things to manage. So how do we treat bipolar disorder in a non-medicalized way? So first of all, it's going to be cognitive behavior therapy. You could have family focused therapy, or there could be that dialect behavior therapy. So all to do with cognition. It might be lifestyle change therapy. Lifestyle changes such as things like going to support groups and more regular exercise, changing the way that we eat. It could be good sleep hygiene. And there's lots of techniques that could be used to try and help with some of this. So again, like progressive muscle relaxation stuff, visualization, grounded skills, mindfulness, anything to slow the cognition down, so you're able to manage that on a much better level. There could be a piece around the trauma, so the EMDR therapy, that might work as well. Ultimately, what you want is a supportive care environment, so that person not having to over worry, because that can then trigger that mania or manic episode. So thinking about then, again, vitamins and supplements, your omega-3s, your Ds and your Bs. Now, if we then move into medication, so medication here, you're going to be looking at mood stabilizers normally prescribed in secondary care, and that's going to be things around lithium. You might look at risperidone, I want to say off the top of my head. There's going to be things such as quetiapine. So any of those mood stabilizing medication that might work to help sort things out. Equally, you might want to try some antipsychotics. So that could be the olanzapines, quetiapines, and risperidones. So that's those. And then finally, you've got your antidepressants just to help with that mood piece. And they're your SSRIs, the selective serotonin inhibitor uptakes. And we might be looking at medication there again around your sertralines, your escitalopram, your venlafaxines, etc. So other medication might help. So it might be the fact that we're going to need some benzos. So that's to help with sleep, to help calm and relaxation, just to bring somebody down. So if you have got somebody who can go quite flighty quite quickly, then we're looking there. Obviously, it's important that all mental health medication for a bipolar disorder is monitored on a regular basis, and that your people have crisis and safety plans. So ultimately, the safety plan needs to have what to do with me if I go manic, if I go hypomanic, or if I become really low and depressed. These are my advanced decisions. This is what I want to do. This is how I want to do it. And those safety plans then become useful for family members. They become useful for secondary care, secondary services, and then emergency services. So understanding kind of how to manage those. Equally, do a crisis card so that person has that information and what to do. So it's important to know that medication is not the cure for bipolar. It may just help with some of those symptoms, but it works in conjunction with the therapy. And bipolar is typically a long-term process, which requires that ongoing support and medication. So that's about your bipolar disorder. My name's Steve. I'm your mental health nurse. Thanks for watching, and don't forget to like or subscribe. Take care. Bye for now.